So we got one.
Hi Sarah, hi Pan, hi Anu. Welcome to your last seminar.
Hi, good morning to everyone.
Yeah.
Oh, this is the last one? I thought there was one more yet or something.
No,
I'm very excited. That's today's last day.
Oh, okay.
Yeah. So we have Dr. Fallah here. Welcome, Dr. Fallah. And today's session is about AI, artificial intelligence. It's a very hot topic in medicine and clinical research. We want to know how AI helps human resources but not replacing them. Like everybody's asking, if we have AI, then what we should do. Will AI replace human resource? I don't think that's the case, but let's wait for Dr. Fallah to educate us today. Go ahead, Dr. Fallah.
Oh, thank you very much, Shelley, for introduction. My name is Nader Fallah. I am working at the Praxis Spinal Cord Injury. That our focus in the institute is improving quality of life of people with a spinal cord injury. I also have an affiliation in Department of Medicine at the University of British Columbia. I'm an adjunct professor there also. Today, mostly I will talk for my own experience at Institute using machine learning on spinal cord injury research. However, that can be easily generalized to any other field. I hope at least part of this presentation might help you to get sense that what we are doing there and how you can use your background to involve for such a research and help this kind of activity. I'm going to my slides. Shelley, my slide is visible now. Am I right?
Yes, I see it.
Yes, I can see it as well.
Oh, one. Let's. I started first slide. First of all, we wanted to know what is artificial intelligence. As you heard perhaps from the media or you may read by yourself, artificial intelligence demonstrates something by machine that we think they might be able to replicate what we do as a intelligence that we have for human or for animals. And what we are saying, intelligence has so many different branches, so many different capability that human has, such as cognition or learning or problem solving or language, and these kind of things. The ultimate goal for this kind of activity is we make some sort of machine that at least might be similar to us, but it might be also be better than us. If it is something that we need to think more. So usually artificial intelligence started around 1940s with one of the paper that people claim that they can replicate how brain works, and then has a very great progress in last few decades, especially when a new branch of artificial intelligence, they call it machine learning, come to the game. And that it shows that how we can use those technology to solve so many problems we have that it is not easy to do by regular things. And recently, last 10 years, a new part of machine learning comes that they call it deep learning. And it is some replication again of our brain. And perhaps you saw some robot that now they comes to the media and people use them, such as Sophia, that they are trying to talk same as us or think same as us. And still they are far from what we do, but it seems we had a good progress in last few, especially last decade, for transferring and understanding intelligence for machine. If I wanted to show how they are connected to each other, artificial intelligence has so many different branches, but we specifically focus on machine learning that related to the data because of the work I'm doing at our institute. And for deep learning, again, we have a different branch of deep learning, but I will focus again on just artificial neural network. That is the one algorithm of deep learning that I will show in one of our example today, that how we use them and how it can help us to answer some questions. If I wanted to be a little bit more specific about machine learning, usually machine learning is related to the data-driven models. If I wanted to compare this with a statistical paradigm, that how they are different, usually in a statistical point of view, we do not rely what data telling us. We have on our hypothesis, and we are trying by using data to accept or reject that hypothesis. For example, if I wanted to see how age related to the outcome, it can, for example, increase the risk of death or decrease it. Usually I'm using some cut points such as 10 years, 40 to 50, 50 to 60, 60 to 70, and go on as far as I want. However, I'm not sure that's the best cut point we can use. Although we assume 10 years interval for age, but it may not be the best things. Maybe when people are their 40, they're 50, they are so different when they are age of 80 or 90, as you can imagine based on your medical background. If we could use data to tell us that how we should, for example, consider cut point for age, that might be a huge benefit of making more robust and more helpful models. We do some sort of machine learning activity at our institute, and our goal at the institute is making some clinical predictive model that help clinician, help patient, help decision maker people to use those models and have a better evaluation of system. They have a better diagnosis, better prognosis, and those kind of things. We also hope that this kind of activity we do in our lab at Praxis Institute help us to collaborate with other people, that they have some sort of background such as you have, such as applied clinical research, that they can come and fill some gap between science, result of science, and how we should send that result to the community, how community can get benefit of our work. But how machine learning has a publication, how much it was used by researchers. If you take a look PubMed, you can see there are so many publications in other fields, especially in cancer, in neurological disease such as Alzheimer's, Huntington, multiple sclerosis, Parkinson, and those kind of things, or cardiovascular disease. They publish so many papers, and we have something around 30,000 publications so far. However, when you take a look at our field that I'm working, a spinal cord injury, you will see very, very few papers. It means still we did not use this kind of methodology in all branch of medicine. Few branch of medicine, they had enough personnel, they had enough money to support those kind of things. But in a lot of them, we have such a gap, and it might be a good opportunity to collaborate and advance our understanding of the any kind of disease, especially for us spinal cord injury. As I explained before, we hope that we use this technique, machine learning, to have a better prediction model. And I will show in one of the example that previously they made some predictive model, but because they use part of the knowledge that was available in data. Their model may not be the best. It might be good to collaborate with so many people with different backgrounds, from clinical background, from the machine learning background, statistical background, computer science. And as a team, we could make a much stronger predictive models. But what we need for such a project, that to be sure that it's successful at the end. First of all, at first we need a good data. It could be national, could be international. We need some people, they have expertise in machine learning. Also, that is very, very important, is we have a good collaboration with clinicians, surgeon, and those kind of expertise. But at the end, one thing is really, really missed here is we may have so many good models, good equations that works very well, but we don't have enough people. They have a good background in knowledge translation. Instead, Nader, you are saying you made a model. You presented for 50 people or 100 people in a meeting. Does this can be used by community? I'm not sure. We need some people fill that gap and send that result to the community also. I mean, still we need some expertise, some people with this kind of interest that comes and help us for next step. I wanted to explain one of the application we had using machine learning in a spinal cord injury. Whatever I'm talking today is about the field I'm working, but of course it can be generalized to any other application also. We had a data set that we had around 1,200 people. They come to Vancouver General Hospital with a spinal cord injury. And we have a registry there. We call it RISCER, Rick Hansen Spinal Cord Injury Registry. We call it RISCER. And I think maybe some of you, you know Rick Hansen, that he had a spinal cord injury by himself, and he's such as Terry Fox, and go around the country and trying to fund this kind of research we do there. Anyway, we had around 1,200 samples. We divided sample in two parts. One part for making the model, and 1/3 of data for validation. I mean, at first we use 60% of data to make our model. Then in rest of the data, we validate if it works or not. And it was aligned with the time that they comes to our study. But what was our outcome? What we wanted to find? We were interested to see who might die very soon in hospital. In hospital mortality, 1-year mortality, and long-term mortality. If somebody is in a risk for mortality, it's good at first place you find that person. And although we wanted to treat all patients equally, but if somebody is in a very, very high risk, you may give priority more to that person to be sure that if he or she is in a risk, you do something, prevent mortality in advance. We had so many variables in our database, but after talking with expert people, clinician, and other researchers, we decided to use few of them. But fortunately, you have a medical background, and so many of them are completely familiar for you. And one of the variables we used was age, and another was neurological severity. I mean, different severity that people have when they have a spinal cord injury. You saw some of them, they are sitting on wheelchair. They might be Asia A, that they have a lot of limitation. But some of them, they have a less severity, that we call it Asia B, C, and D is a usually less severe situation that people may walk, just they may fall from the bed or at night at home, but still they have a good capability to come hospital by himself or herself. And another variable we used was neurological level, that where it was happened. It happened the cervical part of the body or thoracic of the spinal cord injury. Also, another things is stability of a spinal column, that they call it AO spine morphology. And another abbreviated injury scale score that is related to the place that they had an injury also. I mean, they may have an injury on a spinal cord injury, but they may have an injury on face also, or their neck, or abdomen, or other places. These kind of things also were included in the model. Before going to the artificial neural network, just I explain a little bit about biological neural network. As you know, in our brain, we have a lot of neurons. They connected to each other, and they're trying, by connecting to each other, help us to make a decision. We have around 100 billion neurons, that they have 1 trillion connection to each other. And you can see it's a very, very large network that it is not easy to replicate, but it might be an ultimate goal for us to make such a very big neural network. We use same pattern to make artificial neural network. What we do, we have a couple of layers that we call it input layer, hidden layer, or output layer. That input can be variables that I'm using, for example, age or sex or severity of disease. And hidden layer is several layers that help us to increase complexity of the model, to see how those variables should be connected to each other, to be used for next layer, that is the last layer, is the output. That can be, for us, it was a mortality, but can be anything else also. We used one of those techniques that we call it a neural network, that as you can see, we put all of our variables, age, abbreviated injury scale, neurological level, AIS, severity of disease, and AOS spine morphology. And I simplified the model we used, but the model was more complex than you can see here. And we connected all those things together and go to the mortality, to predict mortality. As you can see, here we may have a 1,000, 2,000, even more equations. But if you take a look at the traditional way of making equation, I mean a statistical model, you may have just one model. You are trying to connect age, abbreviated injury scale, and everything else to predict mortality. But what we do in a statistical approach, we assume they have a linear relationship, but they may not. They may have a nonlinear. In that case, this kind of modeling might be more helpful. We applied this model, artificial neural network, and so many other models that I will not go to such a detail because it is, and it's not very important at this moment. And by using those methods, we made our risk score for mortality. You can see for age, we ended up with 4 different categories. For people less than 45 years, we gave a score 0. For 46 to 57, a score 3. And for more than 75 years, a score 10. And being Asia A was a score 4, and cervical level of injury, a score 3 if they are cervical. If they are not, their score will be 0 until last variables that it was AO, a spine morphology. Overall, this scoring system gave us a score between 0 to 28. But how I can use this? When I have these scoring systems, now I can use it for each patient to see how much he or she is in risk. And we, based on the methodology I explained, we made that models and that scoring systems. And when now I have a patient, I will ask the information or using chart to fill the information, and I can see where is he or she score that I can predict his or her probability of death. We compare the model we made. We call it SCIRS, a spinal cord injury risk score, with ISS. ISS is a another model that clinician made before, Angeli Severity Scale. And as you can see, we compared 1 year mortality between the model we developed, SCIRS, with ISS, and it was around 30% difference. ISS, we could achieve 55, but for SCIRS, the model we made, we could achieve our ROC, that correct classification that who will die or who will not, it's around 83, 84, 86. It was same for in-hospital mortality also. I wanted to show you one more example. Suppose somebody comes to our systems, his age is 75, and he's Asia A with cervical and AOS point C and head injury. His score will be something 21. I can put this line here, and I can see his probability of death for in-hospital mortality is around 60%, for 1 year mortality is around 70%, and for long-term 85%. But this is a very extreme case actually. For most of people, probability of death is very low, but depending the situation of person, we are able to make different calculation and different probability. What we found here? We found that, using this kind of methodology, machine learning, AI, can help you to explore something in your data that usually is not easy to detect by yourself. You saw the category of age. It was not easy to make such a category by a statistician or by a clinician. They go to the conventional way of categorizing age. But machine learning gave us different category. Also, they gave us different weight or score, as you saw in our model. And our model easily beats the conventional way of the predicting mortality that usually people use ISS, and almost 30% stronger than the conventional way. It seems machine learning has a good capability to be used for other approach, for other clinical domain, but needs some people to do and have a good data. And the very, very important part is, suppose you have a model. And you published your model, you presented your model in a meeting for 100 people, 200 people, but at the end, people may not use your model. You just publish for yourself somehow, or very, very small community. If some people comes, they can help you to go one step further. That will be very, very interesting. And I think one of the things you learned in this duration of the learning opportunity at Bay River College might be helpful to fill this gap, and you can come and help people to go one step further, because a person such as me or another researcher, when they publish something, they feel they are done, but actually it doesn't seem they are done. Still more work should be done, but somebody should come that has just this kind of interest, knows whole process, know how manage the project, and know that end of the project is not just publishing something or presenting something. It's overall review of what we did here, and thank you for listening for what we presented. We worked and I presented here. I'm more than happy to answer any question you may have.
Anyone? Bueller? Anyone? No? Okay, I've got a couple of questions. One is through the research that you've done and that, do you think that we'll ever achieve unity with AI?
What it means, Leonard, by unity?
Where the AI achieves full consciousness. back in the 40s, as you're explaining, when it kind of all started, and of course the mathematician Alan Turing came up with this test, the Alan Turing test, and for people to tell whether if they're talking to a machine or a human being on the other end of the teletype, as to say, right?
Yes.
So, yeah, but now that experiment's kind of flawed now, or his thought experiment's kind of flawed in the sense where, machines can actually mimic humans pretty good. But do you think we'll ever achieve like full unity where they'll almost like have a consciousness kind of thing?
That was a very difficult question and good question also. There is a expert in that field. They called him Michael Jordan. He's a professor of the AI at Berkeley, University of California of Berkeley. He and a lot of people, and including myself, I think still we are not in a stage of the completely replicate what a human do. What we do is really machine learning, is not AI. We have something such as Sophie as a robot that we think are similar to us, but they can do just part of the work we are doing. It is the question that I think we need more time to be able to answer this question. We should see the progress of the field and direction of that progress. But it seems it might be possible. Although I'm not 100% sure that we will see that, but maybe it can come in a 1 generation, 2 generation later. It will not be achieved very soon, as far as I can see the field.
Oh, okay. And now, as far as building artificial neural networks, what kind of technology are you using? Is it like FPGA or 3D ICs or DSP processors, or?
It depends. For some of our projects, we don't need a lot of computation, and we use just a regular CPU that works for us. But for some other that when we are using deep learning, when we have a very, very large network, in our institute, we attach 16 computers to each other, 16 CPU, and we made a computer that has a GPU and 16 CPU also. And I couldn't reach the capacity that it has. Always it worked well. Even I run some artificial neural network with 10 million nodes. But you can see still I'm far from the brain that has such a 1 trillion connection and 100 billion nodes. We are far from. We don't have any problem. And I applied this kind of methodology in Alzheimer's because I work with those guys also. We didn't have problem with them also, because still the data we have and number of variables we have is not problematic for us in a clinical field. I mean, when you're a student, go anywhere, perhaps they should not have a problem. But for some institutes such as Google or Facebook, the amount of data is so different from us. They may have such a problem, but we don't have in a medical field, at least as far as I know at BC and the project we are running, have a problem.
Oh, okay. So yeah, you're mostly using software emulation of the neural networks then, like, and are you using like C++ or is it Python language, or are you using a proprietary programming language for this?
It depends. For some project, when it is easier to use, I'm using R. As you know, a lot of those model comes from the statistical society. But for some of them that R doesn't work well, we have a very good program in MATLAB. I'm using MATLAB. For some of those, we are using Python. It depends on project and that specific model we wanted to apply.
Oh, okay. Yeah, MATLAB, that's a good language, and found Python's kind of useful for that too.
Yeah.
Yeah, and you're saying you're using the ARM architecture, right? Yeah, and it's a good processor. For because it's risk based and that, so very fast for calculations and that.
Yes.
Definitely, and let's see, and now you probably heard of the work that is being done in Calgary with the neurochip. So are you using, in the studies in UBC, are they using a chip kind of like that while integrating, let's say, connectionist AI? So you put the chip on, let's say, the parietal lobe, so of course the patient would send an impulse to, let's say, move their arm, right? And of course it would transmit the pulses to the muscles in the arm, and then using AI, it would preemptively or connectionist AI, would it preemptively detect the next movement, especially when, let's say, walking, for example. It's the whole mechanics of one's gait is actually quite unique. It's like a fingerprint kind of thing, right? And quite a complex mechanism. So if you guys use like connectionist AI in like communicating with the parietal lobe?
In our institute, we don't use those kind of things, as far as I know, because I'm working in a building that, in our building, we have an institute that they call it I-Cord, that most of the spinal cord injury research was done there. We don't use that, but I saw in one of the meeting people use those technology. It looks very interesting. But as far as I know, in our institute and our building, we don't use. But I'm not completely aware of all engineering department that they may use that technology that I'm not aware.
Right. Okay. Well, thanks a lot. Anyone else has any questions?
Anyone has any question, just feel to pop in it in the chat. Yeah, go ahead, Sarah.
One question.
So,
Sorry, Nada. Sarah, go ahead.
okay, thank you. So, we know that most of the time when we are talking about AI, we mostly talk about the benefits of AI. So, my question is, Dr. Fallah, that what will be the risk of AI in the near future? Or will it be dangerous to a human life or no?
It depends, Sarah. That's a important question, and so many people think about that. You're in the medical field. Your background is medical.
Yes.
You know how much we are different from chimp, from monkey. We are just 1% different from monkey. 1%. Our DNA is 99% same. 1% different. That 1% different make us so smarter than monkey. We made this kind of technology, math, philosophy, art, and the life. You cannot compare our life with monkey. Suppose we make some sort of machine, they are 1% smarter than us. 1%, not more. 1%. How we treat monkeys in our life? How human treat? You know that. How that people, that species, that they are 1% smarter than us, may treat us. That's an option. I'm thinking, if some days we make a machine that they they are a little bit smarter than us, how they treat us. Now there is a new type of neural network that I don't go to the detail. They don't need any training at all. They learn things by themselves. Facebook did an experiment. They put those two machines in front of each other. They started talking English. And all people in machine learning expertise in Facebook, they understand how those two machines talk to each other. And they could predict. After a while, that two machines, they started talking with each other in another language that nobody in Facebook, they understood that what they are talking. Suppose you made a machine, they communicate with each other that we don't understand at all, and they started make something similar to each other. They don't need to be exactly as smart as the way we are. I mean, the cognition we have, and language, and other capability we have. But in a different way, if they are be smarter than us and more capable than us, that is something that we don't know what will happen to us. And some people, they warn continuously, they warn this kind of research we do, that did we consider ethical aspect of this kind of things that we make a machine. And if you offer me a model that is a little bit better than the model I'm using in this project, in next project I will switch the model you're telling me, because why I should stay with the model that is weaker. I mean, I do not consider at the end of the day, I may use something that at all I don't understand what it is, but it can give you better prediction. I mean, I will go a direction to be sure that I'm more successful. Independent from that, do I know what this neural network doing? That is not, I don't care. What I care is make a model that works very, very good, and I can bring to the table a predictive model that predicts patient outcome much, much better than the rest of the world. In that case, maybe unconsciously, most of us also walking in a way that we don't know what's the outcome at the end. I don't know, I answered your question, or I confused you more with different things that may happen.
Yeah, like this made me to bring, like, I have lot of questions, or lot of maybe lots of going on in my mind when you were explaining me this question. So I was just researching on this a couple of months ago, and I saw like that's not a like that's not a public post or nothing like that. So I was just googling it and I was just seeing it. So I have seen that maybe in the near future, the governments can misuse this artificial intelligence, like they can use as a weapon.
They can.
Maybe in that case, it will be very dangerous for us.
Yeah, in fact, in China right now, if I can interject, China right now, they're actually heavily using artificial intelligence to identify people. So like facial recognition, of course, that's been done for a while now. But they're also reading facial expressions as well. To tell whether, marking people, whether if they're going to be sort of like aggressive or not, or be a potential terrorist, that kind of thing. So you're right, Sarah. It is kind of getting scary. And even now, you have YouTube and, the other social media platforms where, before they're kind of listening for keywords in that, now they're actually reading and interpreting inflections of people's voices, like the cadence and whatnot, and to determine whether if that person could be a potential anarchist, as to say. So before, they were just listening for the keywords like bomb or gun or something like that. But now they're actually analyzing the cadence of the voice, the pitch, the everything, right? And you're right, it is kind of scary because if you watch some of the more right side of YouTubers, as far as like politics goes, on the right side, they're all telling about this. So people like Mark Dice and that, and it is kind of scary. And so even the U.S. government, they want to have all these companies, these social media platform companies, to work better at analyzing people and their behaviors. So like Dr. Fallah was saying in regard to the two computers talking, there was another project with Facebook where there was this one group. What they did is they developed this artificial intelligence that would basically read through the Facebook timeline and then post replies to it, right? And so anyway, this artificial intelligence was set up to be like, I think, a 16-year-old girl or something like that. And so she ended up being siding with Nazism and white supremacy, and that based on the chats. So just through the machine learning and what she was learning through all the Facebook posts. And so, this AI just spiraled down into this weird rabbit hole of white supremacy, racism, and all that kind of stuff. It's, so, if we do achieve unity, I mean, oh my God, what is this thing gonna think of, the human race, right? About us. And whether if we should give it certain rights and stuff like that, constitutional rights as well. So it's something that I've been studying quite a bit myself. Or you remember those Furbys? They're like these little dolls that kind of dance a little bit and they chatter. And they found out that they can chatter with one another, and they can actually create a whole unique language, just as Dr. Fallah was talking about earlier. And these things were made back in 1992 or something like that. I had one when I was a little kid. It's kind of neat. And Dr. Fallah, one other thing I'm kind of interested in is the psychological component of AI, in the sense where, if you mentioned that one robot, I can't remember her name, where you can interact with her and she can talk. You had the picture of her as well.
Sophia.
Sophia. Yeah. And so anyway, have you ever encountered where people actually kind of connect with the robot psychologically, in the sense where they start thanking it, that kind of thing, and almost consider it as another being kind of thing? Now, there was a study done in Japan, for example, with the Simo robot that they use, and there's these other robots where kids, like school children, when they're playing with the robot, because how well it spoke and everything, so if the robot fell, for example, the kids would have empathy for that robot. Have you ever encountered any such phenomena?
I think that's very interesting, Leonard. We are, as a kids, we might be connected to the stuff we have, our parents buy for us, because our level of the expectation is that level. However, as you said, if a robot can go to the higher level and stimulate our feeling, in that case, it may not be easy to ignore that person. because now it started communicate with us, and we are feeling that, without that device we cannot live easily. That might be possible, but also if they are unfortunately, if they are smarter than us, that might cheat us also. I mean, it may not be easy to manage those kind of things. Did you see the movie of Ex Machina?
Yes, I did.
Yeah. Did you see at the end what happened? How that girl robot could manipulate emotion of that one of the best programmer in the world. You saw how she did.
Yeah, she was totally able to manipulate them based on the emotions and that she's learned over the time, right?
Because at least she was in his level. At least emotionally, she was in the level of human that easily you can manipulate the human. That person was lost his life because of the underestimate that capability of robot. But I think it should be possible, and we don't need to necessarily completely understand the psychological aspect of human. As far as we may give a basic to that AI machine, they may learn something by themselves. If you ask me several questions about psychology, basic psychology, I may not know. I cannot explain for you, but I know how to deal with other people, and other people know. Even we don't have an expertise in psychology. We do not understand all components, but we learn from something. We learned from our life that how we should deal with other people. And that case, I mean, it's not necessarily they know the basic science of psychology. They learn how psychology can help them to communicate and make people addicted to them. And again, return to the Sarah question that how we should deal with future of this kind of technology that can come and touch any aspect of our life, psychologically, emotionally.
So of course here I am, already, I'm referring the AI like Sophia as her, she.
Yeah.
And so and you're mentioning too where the younger the people are, the better that they adapt to it and accept it, right?
Yes.
And identify with the AI. So yeah, good case in point there. Oh my God, I did have another question, but I can't remember what it was now. Oh my God.
I think now they manipulate us also. No, can you imagine the morning you wake up and you do not check your cell phone, and perhaps each of you are part of some social media, Twitter, Facebook.
Yeah, well, you remember like Blackberries, right? Remember the Blackberry phones, and remember the name that people used to call them too, crackberries, because they're like crack cocaine. People were addicted, and they actually did a study on like how often people check their Facebook stream, right? And and it's something like some people it's up to 80 times a day,
Wow.
Yeah. And it could be in part because the artificial intelligence that they use to, it's almost like a gambling, right? It's kind of like the eye candy. So they preemptively know what kind of stories that you want to see and stuff like that. So, of course, you get addicted to it, right? Yeah, and it's just like your mobile device listening in on you too. You know, you talk about, oh, you know what? I think I'm gonna buy a new TV, and all of a sudden you start seeing these ads on Toshiba, for example, and it's just based on, you know, where you're going and what you're doing. You know, so it's gathering all this GPS data. It's collecting, you know, what you're saying to friends and that, and then you know, all of a sudden, you know, you know, you don't even have to mention the brand name. You just think of it, and you don't even have to mention it. That you know, oh gee, you know, these RCA units are pretty good, are pretty cool. And then all of a sudden, boom, you start seeing the Walmart ads for on sale, you know, RCA, flat panel TV, whatever, you know, that kind of thing, right?
Yes.
So they almost know what you're going to do before you even know it, kind of thing. Yeah.
I have a question.
Go ahead.
So will AI or the robots will have any half-life or any is they will be having any survival rate or anything like that? Or there will be no survival rate at all?
Well, it depends. For our model, you know, machine learning we are using is some sort of AI, is AI actually, part of AI. No, they don't have survival, but we continuously update it by ourselves, because the model I showed you today, it is something it was comes from my last year. But now I have a completely different idea. Now I think if I have few more variables, if I apply another network instead of 10 million node, if I buy something that I can run a network with 20 million node, I may increase. You saw that my result, it was 85%. I may go to the 90%, 95%. Why not? I mean, I continuously update to sell my product. As company they do, they continuously improve the car. They continuously improve their cell phone or software or Windows, that they know we are customer, we will pay in any way. In that case, I mean, the nature of this kind of work showing that they don't care of survive actually. They have a good demand that continuously people looking for new things.
So we can manipulate. We can always manipulate it, right? So it is based on our needs.
It is possible. You are right. It is possible.
Okay.
Oh yeah, Sarah, you just brought up a good point as far as like us being able to control it. So and it was kind of weird because I was thinking about it at the same time. Now, Dr. Fallah, have you ever experienced any unpredictabilities where, for example, the AI had actually changed its own code? So, for example, there's this one game that came out back in I think 2010 or something. It's called Spore, Spore, and it's all to do with like simulating life. It's kind of like SimCity, those kind of games where you develop this environment and these organisms that they eventually evolve. Now, so some of the beta testers of this game, what they were doing is of course testing the game, you know, putting it through its paces, and they ended up with organisms that were totally unexpected. And so later on, the developers, they went back into the code reports from the beta testers, and it actually changed some of the code on its own.
Yeah, there is some sort of the neural network. Their job is just this: they generated code by themselves, and some of the things they do, it looks like funny to us. I saw some study they did. Looks like funny to us, but works very well. I mean, they do some sort of logic that works well, but we as a human cannot understand why you get such a decision. but they have some capability. Suppose you and I, we wanted to compete and go to the beach. I obliged to walk on the street, but you have such a capability, you can jump from the house instead of walking and have a clear path to the beach. And I feel this is what you are doing is funny, but it's not, in my point of view, is funny. But your work is more efficient than me because you reach in third of the time I reach the beach. Although I feel that is not, it may not be good, but that work and you get result faster, more efficient, and better than me. I didn't do by myself, but I'm aware that people are doing, especially some people at US and California, they are very interested in these kind of things.
And then, oh, sorry, Sarah, go ahead.
Sarah, you have a question?
No, at the moment I don't have any questions.
Okay.
I still have a lot of questions, but
yeah.
I think time is not permitted.
Yeah, yes, for sure. There's so many unknowns, and it's a very interesting topic. And I'm sure this will attract considerable policy effort, how we can put this into practice and control it. And in my field, I believe this will help greatly to at least accelerate medicine and drug development. So I so much look forward to more information. And Dr. Fallah, thank you so much. We're coming to the end. And you mentioned a great topic during your conversation, your presentation. You said that when scientists like yourself, you publish something, it's not for the sake of publication only. You want other stakeholders, other parties to come together and see how this how this will reflect in the community. It's a very, very good point. Hopefully we can tackle this one day. Well, thank you.
I have a quick question. Sorry about it. So yeah, I think in one of these slides you have mentioned some mathematical concept. So my question is like, does artificial intelligence includes math in it or not? Because I'm very interested in this topic, but if math is involved, then I would definitely not consider it.
It depends on situation. So if you are an end user, you may not know the whole detail. But if you are a developer, usually it assumes that you should spend a lot of time to learn math and stat behind of all equation and all type of modeling. Yeah.
So like as we learn about the clinical research coordinator, like what will be the role? Will I get the job in artificial intelligence area, or there are very less or very few chances?
No, actually, I was trying to explain this. I don't know how much successful I was. I wanted to say, you don't need to be an expert in machine learning. As far as you can sell the product of machine learning people to the community and do something that help community can get benefit, because community pay to us. It is their right to use the result of our work. But we stop somewhere. Some people should come and do these kind of things, and to be sure that now they are using our result. If the model I presented, if I publish it but nobody use it, it is not helpful. We need somebody comes and go one step further, make an app, make a software, make something available in all hospitals in Canada or around the world, and people use that kind of model. We have a problem for that part. In that case, I like this kind of background you have, that you can come, you don't need to be expert in machine learning, but you can do something and bring those kind of things for community. They said, this is a product these people made, it works, and so several other people also validated, not just ourselves, so many other people, they validated. Now I'm trying to bring it in community level, and all hospital use it, all clinical department, in ambulance, and those kind of people, but nobody did it actually. Recently, we try one of our work to make an app such as app you have in your cell phone, but it was just for one of our projects. I was involved in at least 20, 30 different projects, but none of them was turned to the app. I feel that there is a big gap. We need help from people to come and help us for those kind of problems we have. Even some people may not appreciate that role, but it is very evident for me that is really important, and people, they don't know how much is good and how much is helpful to turn those investment, those money, time, work, investment to the real application.
Yes, thank you.
Shelley, thank you very much for this opportunity and managing the meeting. And it was very nice to visit all of you. And sorry, it was not enough time to go to the other question that other student may have. But I have my email address. If you feel there is something that I can help, I'm more than happy to answer your question.
Sure. Thank you so much, Dr. Fallah, for your time. I know you have a busy schedule. That's greatly appreciated. Yes, I highly encourage everybody to stay connected with you on LinkedIn or via email. And hopefully we have other meetings soon.
Sure. Thank you very much for this opportunity.
Thank you.
Thank you, Dr.
Thank you very much.
Thank you
very much.
Enjoy the rest of the day.
You as well.
Thank you.